Hello guys, this is Dr. T, and once again welcome to Clinical Medicine. So guys, in this video I just want us to quickly talk about how does an infection actually kills or cause mortality. Or cause mortality. How does an infection kill? Guys, as we all know, infections are dangerous, and they are very dangerous, and they also, how brutal they are also depends on a lot of things. There are so many other factors that play a role, like the age of the patient. Are they too young? Are they too old? The immune status of the patient, and also the nutritional status of the patient, and the location of the infection. Where is the infection? And maybe I should write this at the end and just list them. So let's start by defining infection. Infection So what is an infection? As we all know that an infection is just an invasion. It's an invasion of a sterile tissue or organ or space by a pathogen. That's an infection. And when we have an infection, an infection can progress to sepsis. And a severe form of sepsis or a complication of sepsis is septic shock. Coming back to pathogen, at this point we know that there are different types of pathogens. There are viruses, bacteria, fungi. Those are the most common. We're not going to get into microbiology, but we know that bacteria can either be gram positive or gram negative. We've got anaerobes, we've got cocci, we've got bacilli, and all of that. So we've got an infection. So we're trying to answer the question, how does an infection actually kills? And this is broad. Because I'm not focusing on a specific type of an infection. I'm not talking about UTI, I'm not talking about septic arthritis, I'm not talking about meningitis, I'm not talking about a foot ulcer. I'm just and I'm not even talking about a surgical wound that has become septic. I'm just talking about infections. So I think in the future we are going to talk about specific infections like pneumonia, talk about abscesses, talk about this and that. We are going to talk about that. But this is very, very important. So, maybe so I don't know if you heard me. I said that an infection can progress to sepsis and progress further to septic shock. I know many people, they use infection and sepsis interchangeably, but it's not supposed to be the case. If we are strict in our wording and our terminology, infection is not the same as sepsis. They're not the same. Like I'm saying, it's a progression. Once you get to sepsis, it means you are coming from infection. You have an infection somewhere. That's why when someone comes in septic shock, the doctor will look for the source of sepsis, which is the location of the infection. Where is the infection? Where is this sepsis coming from? Where is this infection? Where in the body is the infection? So once a patient comes in with septic shock, you want to go back and trace where is this coming from. So, and I've been in ward rounds where a doctor would look at a patient who's got an infection in the foot, and then they say, this is sepsis. Like I'm saying, if we are strict in our wording, that's not sepsis. We are going to talk about what differentiates sepsis from infection. Okay. Another thing that you guys must remember is that you can have sepsis without septic shock, or you can have sepsis with septic shock. Or, let me put it this way, you can have sepsis and not have septic shock. Let me just put this here. So, what I'm trying to say is, when you have sepsis, does not mean that you've got septic shock. You might have sepsis without septic shock. So there are patients that you're going to find them here, they just have an infection. Then there are patients that you're going to find them there, they have sepsis without features of septic shock, or you find them here, or you find them already down here with a multi-organ dysfunction, or you find them here. I hope you get this, guys. There are patients that you will find them, they're already dead because of whatever infection that they had. You come, you certify. Or they come to you with already organ dysfunction, and then they eventually demise. Or you find them here and you are able to correct the infection and bring them back to life again. Or you just find them there. I hope this makes sense. Okay. Let me create space. And also, the manner in which you manage your patient depends on where do you find your patient? Where is your patient in terms of this? Are you talking about someone who is here? Are you talking about someone who is here? Or someone who's here? Or someone who's here? Or someone who's just here? So your management is gonna depend on the stage of the infection. So what I'm gonna talk about, guys, is something that you already know. I'm not gonna go into details. Like, this is clinical medicine. It's not really about your deep pathophysiology and all of that. So we say you've got a pathogen. This pathogen comes in and invades the tissues. And in the process of invading the tissues, it multiplies. And as it multiplies, it damages the tissues. There are different ways in which pathogens damage tissues. There are different ways. One of them is they take the nutrients that the cells are supposed to be getting, and then they use them, the glucose, they use the oxygen, and on top of that they excrete some substances which we're going to talk about. Basically, so let me say they deny the body cells of oxygen and nutrients. They also secrete toxins. I'm sure there are other ways in which pathogens damage body tissues, which I'm not going to talk about here. So now you end up having damage to your cells. And once your cells get damaged, basically the inflammatory cascade begins. The inflammatory process begins. So the inflammatory cascade is there because you've got an invader and the body cells are trying to respond to that. The immune cells respond to that. So the reason why you've got an inflammatory cascade is because you have a fight between the pathogen plus the immune cells. This is why you've got your inflammatory cascade. And they are at the same time trying to clear the infection and so that a repair can start taking place. And we know the 5 signs of inflammation. The redness, and we know how redness comes. Redness comes because you get dilatation of your vessels. Because the body says to itself, okay, if we can get more blood coming into this area, we can be able to transport more macrophages to the area and get more oxygen and get more nutrients for those damaged cells. So the cells, the arteries, they transform from being that small to now being this small, and you get the redness. And because of the same reason, because now you've got a lot of blood that comes in, you get an increased temperature, a localized increased temperature. Like the heat goes up there, that place becomes warm, and on top of that, there's pain. These are called the cardinal signs of inflammation. And because you've got a lot of blood coming in there, you get swelling. You know, the reason why people put on ice when there is swelling is because once you put on ice, you are pushing this blood vessel from being this big to being this big. Because when you expose a blood vessel to low temperatures, they constrict. That way you minimize the swelling, you minimize the pain, you minimize the redness. That's the reason why people put ice when they are having swelling and having pain from whatever. So, and then you get a loss of function. The reason why people get a loss of function because of an infection is because of the swelling and also because of the pain. So these are called the cardinal signs. The cardinal signs of inflammation. Right? So now as you have got this pathogen that it has caused this infection. Now the cells that we spoke about here, the immune cells, in an attempt to fight the infection, they say, guys, okay, let's call more people. This is a complicated kind of a thing, because the endothelial cells that are damaged, they initiate also the inflammatory process. But in broad terms, so you've got now these cells, the immune cells, they start to, when I say immune cells, I'm talking about your natural killer cells, your macrophages, and neutrophils. So they start to secrete cytokines. And there are many cytokines. I'm just going to mention a few, like your tumor necrosis factor, your interleukins, I think there's about, there's interleukin 1, interleukin 2, 3, 4. I think there are about plus minus 20 interleukins out there. And one of the functions of them is they cause chemotaxis. And chemotaxis is a way in which macrophages and other cells, other immune cells, are attracted to the area of the infection. So they've got that chemotactic ability. So once they're secreted, remember, these as cytokines, because they've got this ability of attracting or of mobilizing other immune cells from different parts of the body to this area. Now if they come in flooding, you need your blood vessels to dilate to allow them to come in, so that you can minimize traffic and make sure that they get there in time. That's one of the reasons why you get dilatation of your vessels there, right? And one of the reasons why people get fever is because of the secretion of your cytokines. And it also depends how much cytokines are being secreted for someone to actually have a fever. Okay, so guys, let us break. This video is about 20 minutes. I'm gonna upload part 2 of this. It's very important. It's almost done anyway. Thanks for watching.